Hi everyone, I hope you guys are keeping well. In this video, I'm going to talk about lateral and medial epicondylalgia, which is a common condition that many people suffering. It's a common name that we use like golfer or tennis elbow, that you feel pain in the medial and lateral part of your elbow. We're going to introduce basically resistance bar from Fitbeast. In this video, I'm going to introduce you this useful tool that you can use for your rehabilitation and your recovery. Let's get started. If you've never been to this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. I'm going to basically show you a series of exercises in this video with resistance bar that can help you to recover from your injury. But before that, I would like to explain for you what is lateral and medial epicondylalgia in a very brief way is. In many cases, people are active and using their hand in a daily basis, but lateral and medial epicondylalgia happen when you overuse those tissue, like commonly tennis player, golf player, or sometimes even a rock climber can commonly get this problem. And the main cause of this condition is repetitive use of those tissue, which means you constantly using those tissue without giving them a proper time for recovery. In this video, briefly, I'm going to show you what exercise can be useful for you for that condition with this basic resistance bar, which is very simple, and you can basically carry this tool in anywhere in your bag, and also give you a brief idea of management, how much is too much, and how you should actually manage this condition. As you can see, the basically resistance bars are coming in 3 different colors in a pack, and these colors have different strength. But eventually, if you are suffering from lateral and medial epicondylalgia, you're going to start initially your rehab with the green color, because this is the least strength that you have, and you're going to progress from this to blue and the red, which is the most strongest one. This basically product is pretty solid, and we're going to go through the exercise that you're going to do in a daily basis for your rehab. Having said that, before you start these exercises, I would highly recommend you to contact your physical therapist and ask them for recommendation of how many sets or repetition that you need to follow for your recovery. You can simply leave me a comment underneath of this video, and I would be more than happy to give you some tips. The first exercise that we're going to do is going to be for the wrist flexor. The flexor of the muscle of the wrist, basically it comes from all the way from the wrist down to the medial epicondylalgia and connecting this tissue. And if you are feeling soreness around here, we're gonna basically strengthen this muscle. Having said that, we are not trying to really kill those muscles. We're gonna slowly build them up, and based on your severity of your injury, you're gonna progress them gradually. The first exercise is gonna be a wrist flexor, which I'm gonna show you how to do it, and you can give it a try. For strengthening the flexor muscle of the forearm, we're going to use this technique. You're going to bring the bar in front of your face, and you're going to twist here and straight the arms in this position. You're going to can hold it for a few seconds and gradually let this arm basically relax. You can come back to the starting position and repeat the same basic movement again. You know, strengthen there, hold it there for 1, 2, and 3, and slightly gradually release that grip. Come back to the initial position. We go back. 3, 2, and relax. As I mentioned earlier, the amount of repetition and the set that you do is based on what your physical therapy will suggest you. The second exercise that I'm going to show you guys is going to be for extensor part of your forearms. And if you're feeling pain around lateral part of your elbow, this can be a suitable exercise for you to try. You're going to hold the flex bar here, and from here, you're going to twist flex bar and straining your arms. You're going to hold in this position for 3 seconds, 2, 3, and relax the arm. Coming back to the starting position, you're going to rotate it here and straightening your arms. You can hold it there for 3, 2, and slowly relax the arm. You're going to repeat it one more round. Take there and straight the arms. 3, 2, and relax. The next move that I'm going to show you guys is going to be supination, strengthening exercise with basically resistance bar. I'm going to show you how to do it. You can give it a try. In this movement, simply you're holding the resistance bar and supinate your both arms. You can hold it there for 3, 2, and slowly relax that. Go back there, 3, 2, and relax. 3, 2, and relax. Now, if you want to progress that, you're going to basically hold that and slightly twist that movement. That's going to be the progression of supination. And relax. Hold it there for 3, 2, and relax. We're going to move on to pronation, which is simply the opposite of movement of the pronation, and you are going to hold the bar in that position and simply twist it in this manner. Hold there for 3, 2, and relax. You're going to go one more round. 3, 2, and relax. Slowly back. Slow tempo, 3, 2, and relax. Now, if you want to progress that, you can simply start rotation there, 3, 2, and relax. I'm gonna go one more round, 3, 2, and relax. 3, 2, and relax. Basically, you can do both movement, pronation and supination, back to back if you feel comfortable, but the rest that you do between each set is based on the severity of your injury. We're going to move on to radial deviation of the basic wrist movement with the resistance bar. I'm going to show you how to do it and you can give it a try. You're going to hold the bar in this position and use the bench basically for holding that bar. You're going to hold in that position for 3, 2, and relax. Go back, 3, 2, and relax. It's pretty effective. It's very isolated, and I really like the basic resistance of this bar. It can hold it pretty nice. It's so different from the free weights because usually we suggest our clients to use free weights, but this can actually give them a very good control. Go back on it, 3, 2, and relax. The last exercise that I'm going to show you guys in this video is going to be ulnar deviation with the flex bar, which you can simply hold the bar in this position and basically simulate the ulnar movement. Slow control down. Again, 3, 2, and relax. Pretty control, very nice grip. You can definitely feeling that movement happening in the wrist. Slow control down. You're gonna do one more round. And relax. I hope you guys find this video helpful. If you have any question regarding lateral and medial epicondylgia, leave me comments underneath of this video and I would be more than happy to help. This tool can be a really good extra in terms of helping with your rehab exercises. If you're suffering from lateral medial epicondylgia or tennis elbow or golf elbow, or they call climber elbow, you can basically use this tool for your recovery. In addition to strengthening your forearms, this tool even can be a really simple tool for foam rolling your forearms. I kind of like really try it around. And if I'm sitting in a chair 2-3 minutes, sometimes if my forearms feel tight, I basically foam roll it a little bit and it feels actually really ease off after 2 to 3 minutes. But the main source of basically using this bar is for strengthening your forearms. I will leave a link below that you can get access to it. And if you have any question regarding using it, leave me comments underneath of this video. Make sure to subscribe my channel for my weekly update and don't forget to press that like button. Until next week, all the best.